Welcome to tonight's webinar. We're going to talk about the GI tract. This is packed full of information. I've made this such that it should be very practical. So let's move right into it. The first thing I think the important concept to understand about the GI tract, of course, we know it is foundational health. We also know that the brain and the gut are connected. It's called the brain-gut, gut-brain axis. And this is really what drives physiology in the body. It's what drives the autonomic nervous system. It's what regulates things like the immune system, the hormone system, the endocrine system, I should say, the nervous system. Pretty much all systems are driven by this brain-gut, gut-brain axis. So anything that happens to the GI tract is going to actually have an impact on the brain-gut, gut-brain axis. Anything happens to the gut, it's going to happen to the brain. And so there's a far-reaching symptoms that can come from people who have GI tract problems. Number one, if somebody has GI tract problems, they may experience symptoms that are related directly to the GI tract. And this would be along the lines of things like bloating, constipation, diarrhea, abdominal pain, and these kind of things. People can also have what are called immunological symptoms. Multiple food sensitivities. This is somebody who do a food sensitivity test and half of it's red. So this is a sign that they have GI issues that's relating to food sensitivities. You can have increased reactions to food, chronic pain, skin issues, autoimmunity, and there's even more, but those are kind of the main ones. We can have non-gastrointestinal signs and symptoms when people have GI problems, and that would be fatigue, depression, poor metabolism, obesity, diabetes, metabolic syndrome, neurodegeneration, neurodevelopmental. These are, ADHD, OCD, autism, and whatnot. Keep in mind, when somebody has inflammation, if I can put it this way, if somebody has, this is a picture of the brain. Here's the nose and the mouth, and here's the brainstem. If somebody has inflammation in the brain, and by the way, if you have inflammation in the GI tract, guess what? You have inflammation in the brain. So if you have inflammation in the brain, the three top symptoms that we'll see associated with that will be depression. Oops, sorry, let me get my pen straight. Depression. We're going to see fatigue, especially upon mental activities. Like I read a book, I fall asleep. I read a book, I get tired. I drive over an hour, I'm tired. I go to work, I'm just tired. I get, I'm not off work, I have enough energy. So it's what I would call mental fatigue. Fatigue upon mental activity. So depression, fatigue, and the third one would be brain fog. If you have any one or three of those, it can be an indication that you have inflammation, brain inflammation. A little hard to evaluate brain inflammation from a laboratory standpoint or any other means because we can't really see it so much on the blood. But when you see a patient has depression, fatigue, and brain fog, you really want to think about this picture of possible brain inflammation. Now, let's reverse it a little bit. When somebody has GI inflammation, if somebody has GI inflammation, this is a prime source of brain inflammation. So I just wanted to put that there while we're on this subject. So when somebody has fatigue, they have depression, poor metabolism, these type of things, these are kind of the non-GI related symptoms. You can have others too, of course, because you're talking about the brain-gut-brain axis, it touches everything. So. All right, so let's talk about the basics of digestion from north to south. The first thing we do, of course, we chew food, right? We chew food, and that breaks it down. And don't snooze off on me because this is actually really important. We're going to talk about this so much tonight. I'll say something about it here. We probably won't address it much more the rest of the night. But it's really important that people chew their food well. If you don't chew your food well, then you really are hampering the rest of your digestive process. What is chewing food well? Well, it should be kind of at a mush by the time you swallow it. Usually it's about 30 bites, but it depends on what you eat. If you eat something, like a fruit or a vegetable, I would say vegetables, but a lot of fruits, you're not going to be chewing that a lot, of course. But if you eat like a steak, you're going to be chewing that more. So it's kind of relative. So if you say 30 bites every, food is probably not practical, but you just need to mash down the food well enough. And what happens is once it gets mashed down well enough, then it gets down in the stomach where it gets in the presence of hydrochloric acid. Let me say one more thing about the chewing, because there is one other aspect that needs to be addressed. Actually, two aspects. Some people have TMJ problems. You know, you have them open their jaw and it goes dink, 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 or whatever. If they have TMJ problems, or they can't get over 3, you should be able to put 3 fingers in your mouth like that. If you can only get 2, that means you have a TMJ problem. So some people with TMJ problems can't chew very well, and they don't really think about it so much. They just kind of live with it. So, but these people usually are not chewing their food that well. So you want to evaluate your patients for TMJ problems, because if they do have a TMJ problem, they might not recognize that they're not chewing their food that well because they're just so used to it. That's one aspect. The other aspect, some people are on medications that will dry their mouth out, and so they have lack of saliva production. If you have lack of saliva production, this is also an important aspect of the fundamental, digestive process, because we have saliva in our mouth. You have enzymes in there that start the breaking down process of food, and so we really need to have the saliva in there. Some people are on anti-parasympathetic medications. When your parasympathetic nervous system gets weak, that's when your mouth gets dry. That's what happens. You know, when you get really scared and you're getting ready to talk in front of people and, your mouth gets really dry, what that means is your nervous system is kind of tilted over into a very weak parasympathetic response. It's related to a hypersympathetic response, so to speak, but really more so when you get a dry mouth. It's because the parasympathetics, have been wiped out. There's also autoimmune conditions like Sjogren's and things like that you'd be aware of. There's actually supplements people can take over the counter to help with the saliva production. So if somebody has a TMJ problem or saliva problems, that's something you look at. From an examination standpoint, looking at the saliva, you can have somebody open their mouth. It should be nice and shiny in there. If they open their mouth and it's it's dry looking, of course, then that could be lack of saliva production. So chewing the food, TMJ health, and saliva production is really important, because the food is going to go down into the stomach where it hits the hydrochloric acid. So there's a lot of important things here, of course, but let me draw something out just from protein metabolism and the breakdown of proteins and so on and so forth. We'll talk about fats and starches and sugars here in a moment, but let's just start with the protein. If you were to look at a protein, what a protein really is, it's a long chain amino acid that's stuck together in a very specific way. Most proteins are going to be somewhere between 40 to 50 to 60 amino acids stuck together, up to 600 or 700 amino acids stuck together in a very specific sequence, depending on the amino acid. Now, how the amino acids are linked together and how many are linked together will determine the structure of the protein, and the structure of the protein really determines its function. So when you start the process of chewing the food and you start with the saliva, you already start breaking down to some degree the protein. When the protein hits the hydrochloric acid, what it does is it breaks the protein down into little bitty chunks, and we call those chunks polypeptides. Polypeptides. Poly means many. Peptides is a series of amino acids. So what happens in fundamental is you go from these long chain amino acids, like maybe 50, 60 amino acids long, down to strands that are maybe 2 and 3 and maybe 4, maybe even 5 amino acid stuck together. But they're broken down. They're not into their form of an individual amino acid yet, but they're broken down into that form. Then it goes down into the small intestine. When it hits the small intestine, there's something very important that happens. And I really want to make this point because I think it is underappreciated, even in the world of functional medicine. It's certainly underappreciated. It's not even on the radar, if you will, in traditional medicine. But in functional medicine, it can be underappreciated too. And that's this. Hydrochloric acid, when it mixes with food, it becomes a bolus. This bolus is food mixed with hydrochloric acid, that's what they call it. So this bolus now is pretty acidic. So when that bolus first hits the small intestine, what happens is there's a radical shift in a decrease in the pH. So in other words, the small intestine becomes a lot more acidic right where that that bolus hits in there. When the small intestine, it has that acidity, when that acidity drops, this activates the pancreas to release digestive enzymes. Also, sitting over here, we have the liver and the gallbladder. So when, we know that bile is stored in the gallbladder. So when that pH of that bolus drops the pH in the small intestine, immediately, boom, it triggers the pancreas to release digestive enzymes. It also triggers the gallbladder to contract and release the bile. That way, we absorb the fat. So if bile doesn't flow, of course, the bile becomes sluggish, and the bile becomes sluggish long enough, you develop stones, and there's a whole host of problems. We'll be talking about that in a little bit. But right now, I just want to recapture where we're at, because we're talking more about protein metabolism, or protein breakdown, if you will. So we chew food. That's an important part. We have to have enough saliva. If you have TMJ problems, you have to check that, make sure people are consciously chewing their food enough. Once it hits the stomach, it encounters hydrochloric acid. The hydrochloric acid breaks the proteins down further into what are called polypeptides, which are smaller chains of amino acids. Those small chain amino acids, they come down into the small intestine. And when they hit the small intestine, what happens is they're only like 3 and 4 strains of amino acids put together. What happens is the digestive enzymes get a hold of them and break these bonds down, and they become individual amino acids. These individual amino acids go to the liver, where the liver processes them. These are liver cells. We have millions of liver cells. Sorry for the bad drawing, but the amino acids go in there. And so what happens is, you've heard of ALT, AST. These are what are called transaminases. These are enzymes that are found in the liver. These enzymes, one of their major jobs is to help process those amino acids and produce and make new proteins out of it. So basically what we have is, we have chewing our food. It goes in, it gets broken down by the hydrochloric acid in the stomach, and then it goes into the small intestine. It is the acidity of that bolus that drops the acidity in the small intestine, and that's what activates the pancreas to release digestive enzymes. You release the digestive enzymes, it takes those polypeptides down into their individual amino acid form, and that individual amino acid form goes to the liver. The liver processes it, makes the proteins you need out of it, and then it goes out to the heart, and then it goes out to circulation. So this is how we get food that we eat, protein that is, into our system to build our bones or ligaments or tissues or structures. But not only that, keep in mind, inside every cell is full of proteins. That's what drives cell. In fact, if you look at the DNA inside of a protein, what does DNA do? DNA does one simple thing. It produces proteins that are unique for that specific tissue cell, so that that tissue cell can carry on the jobs that it's supposed to do. So that's the basics in that area. Now, I'm going to go on to the next slide. I'm going to keep this a minute because we might come back to it. I want to go on to another aspect of this. Okay, so if you are sitting right here and you don't have enough hydrochloric acid, so you're low in hydrochloric acid, then nothing really good happens beyond that point. So if you're low in hydrochloric acid, your small intestine is not going to have that drop in pH as it should. And when that happens, you're not going to get a good activation of the pancreas to release digestive enzymes, and you're not going to get a good activation, contraction of the gallbladder to get the bile to flow in there so you can absorb the fats. there's also one other aspect. We need hydrochloric acid to help us build what's called diversity in the microbiome. So if you have low hydrochloric acid, now this is whether you medicate it that way or whether you just are not making enough hydrochloric acid, then you're going to be potentially deficient in pancreatic enzymes. You're going to be potentially deficient in bile flow. You're going to be potentially deficient in your ability to have a diversified microbiome, and it's the diversity of the microbiome that really counts, that gives it the juice. So I just wanted to make that point, that hydrochloric acid is very essential, and it's one of the more underappreciated areas. It's definitely underappreciated in traditional medicine, because if you have heartburn, what do? They just put you on a proton pump inhibitor, call it a day, and say, as long as you're not in pain, everything's fine. I understand if you have acid reflux, that acid can go in the esophagus, can burn that up. That can become a cancer risk. Reflux can go up here. It's called silent GERD. It can come up here and go down to the lungs, cause chronic coughing and other things in the respiratory system. There's other issues that can happen if you have GERD. So GERD is a problem. I totally understand that, but the solution is not to just simply take a proton pump inhibitor, call it a day. You have to work through the issues as to why you have the reflux. And by the way, many of the things I'm talking about tonight are going to be the most common causes of people having, this GERD and these things that we have to deal with. All right, so let's take, let's go and walk in. I've got more to talk about in the area of what's going on in the small intestine, what's going on in the gallbladder and bile flow and so on and so forth. But let's go ahead and walk through the rest of the presentation, and we'll get to each one of these. In 10 minutes, Dr. Annette, I'm going to ask you if we have questions. So we'll be answering questions in 10 minutes. So if you guys have questions over anything, go ahead and feel free to ask them. Okay, so some time ago, they came up with, and I believe it was, oh my goodness, if I wasn't trying to think of his name, I could think of his name. Bland, Jeffrey Bland, Dr. Bland, came up with this. He called it a 4R program, and then they added an R. So there's a 5R program for basic digestive health. And there's nothing wrong with this. I think it's actually a really good place if you are, beginning to do digestive work, you're doing a GI work. This is really a good place to start. So in other words, when a patient comes into your office, this is a nice little model to follow. I'm going to show you some things that you can do that will improve this and even help you be more efficient with what you're doing clinically. But this is a good place to at least start. And by the way, you don't want to, this is the way you don't want to do GI stuff. Somebody comes in and you want to start with GI. So no matter what, you just do, your pet things, and you call it a day. When we look at GI problems, we always want to assess what specifically is going on so we understand how to more efficiently work through it. Having said that, this is a general model that's not really a bad place to start. So we can start here and then add on to this as we find clinically is shown. Now I'm going to show you some things before this hour is over that'll help you. Okay, so 5R program. Let's look at this. First, remove. We want to remove undesirable organisms. Well, this might be opportunistic infections, or it might be bacterial infections, yeast infections, different infections that could actually be going on in there. Inflammatory foods, food intolerances, food sensitivities. Where I would start when I'm first starting with a patient, the very first place I'm going to start in this remove process is I want to know what foods are sensitive to. So I'm going to say it's not 100%, but it's very close to 100% that every patient I have come in that I'm working through this model, I'm going to have food sensitivity testing done. It's not the end-all be-all. It's not going to solve every problem, but it's one of those things that's foundational. If you don't find out what foods they're sensitive to, you're always going to be behind the 8 ball. You're always going to have one arm clinically tied behind your back, and you're not really going to have the success you need. Now, sometimes you'll do food sensitivities on somebody, and bam, that is it. That's 80, 90% of the problem, and you've done very well. Sometimes it's not, and I don't want you to be misled into thinking just do food sensitivities is all good. But I definitely want to get the point across that this is a foundational place that we really need to start. So get your food sensitivities done. I personally like to go through owl tests, Some people use Cyrex. I use Altest. Simply, it's a little easier financially, and I know that the Cyrex has a good lab. They do cooked foods, they do raw foods. It's a little more extensive, but I find for my clinical usefulness, Altest does well. And once I do Altest, then I will go through a process of the patient's going to have to do some trial and error as we go along to build a strategy for life to what foods are sensitive to and not. And I probably am going to do a whole webinar one time on food sensitivities, you know, just to kind of get these points across a little bit more effectively if we can. Okay, so food sensitivity is a good place to start. If you do not have a way to do this, then I'm going to suggest that you join along with Pink. And I have, Dr. Annette is here, and she actually is one of the owners of Pink. And to join Pink, it doesn't cost anything, and it's a basic co-op group. So what they've done is they've contracted with Altest. And if you're a part of Pink, you can actually get your Altest food sensitivities for a cheaper rate. So Dr. Annette, I didn't ask you before we did this, but can you give us information if you happen to be out there on that, like how they could get contact with the Pink organization to set up an account if they need?
Yeah, you can email info@pinctesting.com, or you can go to our website, which is pinknationwideservices.com, and that's PINC nationwideservices.com, and there's a membership form at the bottom of that homepage.
Okay, that's PINC.
Yep.
Pink, and
yep.
What is it?
Nationwide Services.
I'm going to make sure I get this. Services.com. You want to get that kind of in your browser and just click it so you don't have to type that every time, right? So you can go there and download a form. It doesn't cost anything to join. They have a whole lot of things to offer right there. I'm not really here just selling that, but it's a great service, and it will save you money on doing your food sensitivities, and they will process and do all the work really for you. They're not going to sit down with your patient, but they will do all the other parts of the work. Okay, so food sensitivity is a great place to start. Now, what I just alluded to a while ago is hydrochloric acid, digestive enzymes, bile flow. We have to be able to assess this and understand how to use these things. And really, the rest of this hour, that's what I'm going to be talking about. Then we're going to, you need to build the microbiome with diversity. And here's some nutrients that you can that'll help give fuel and nutrition to help build the GI tract, the gut barrier, and there's some micronutrients and minerals. Tonight, I'm going to focus on the HCl, bile flow, and the digestive enzyme portion of this 5-hour program. All right, so 5 basic essentials to digestive health: hydrochloric acid, digestive enzymes, bile flow, and I just talked about food sensitivities and microbiome. Tonight, we're going to be doing HCl, digestive enzymes, and bile flow. Here is a clinical pearl. So when a patient complains they have digestive issues when they eat, if they eat meat, they say, anytime I eat meat, I always have bloating or I have some kind of digestive issue. If they're eating meat, you want to think about low hydrochloric acid. Think about hypochlorhydria, low HCl. If they eat carbs or starches, you want to think about pancreas and more in the area of like digestive enzymes, okay? If they can't tolerate fat, greasy, or fried foods, you want to think about gallbladder, and you want to think about bile flow, okay? If all foods bloat them, you want to think about SIBO. Now, what I would say about this, though, is this. Just one quick thing on SIBO, because we don't really have time to go too much into that, but I want to say something about it because I think it'll be helpful clinically. Here's the stomach, here's the small intestine. Between the small intestine and the large intestine, you have this right here, what's called an iliocecal valve. So the food is supposed to move through here like that, and then this is how it exits. That's how you have the bowel movements. But food should not go, once it's in large intestine, it should not back up. So this valve looks like this. So food goes this way, but if it tries to go this way, that valve is supposed to shut. Well, some people have weak ileocecal valves. And if you have a weak ileocecal valve, then what can happen is you can have what's called translocation. You have 10 times more probiotics in the large intestine than you do in the small intestine. You have a larger population. But the bacteria in the large intestine should not get into the small intestine. If you have that, that's what it's called SIBO. It's called small intestinal bacterial overgrowth. It really should be called, translocation. Wait a second. Okay. Should be called translocation of the good bacteria. So it's translocation syndrome, really. But this is what SIBO would look like. But keep in mind that the bacteria, the good bacteria that's in the large intestine, is going to do things like ferment the foods and so on and so forth. So when these bacteria, good bacteria, get in the small intestine, what they do is they cause a lot more fermentation. When they cause more fermentation, you're going to bloat more with like starchy food, galactans, and different things like this. So if you're having problems with this, you may have SIBO as well. It's problematic with the testing for SIBO because some of the bacteria that leaks from the large intestine to the small intestine, some of it will produce hydrogen off-gassing, and some of it will produce methane off-gassing. So you can do a breath test to see if you're off-gassing. Problem is not all of the bacteria that escapes from the large intestine to the small intestine will actually produce the off-gassing of hydrogen and or methane, and so therefore you can get a lot of false negatives when you do the SIBO test, and there's cost involved and so on and so forth. So one of the best things to do is if you suspect that somebody has SIBO, a good thing to do is actually have them follow strictly a FODMAP diet. Have them follow a FODMAP diet and see if symptoms improve within 2 weeks. If they improve within 2 weeks, then this gives you some clinical, I don't want to say evidence, yeah, let's say evidence, clinical evidence, but it gives you at least some encouragement that, yeah, this could be SIBO, and then you can go down the track. And some other time we'll talk about what to do with that. But anyway, I just want to put that while it's here. Clinical pearls here. Somebody eats meat and they just sits there like a rock. It's something in the stomach, low hydrochloric acid. If they eat carbs and starches, it can be SIBO, but it can also be digestive enzymes. And some people will say, you ask them if they have problems with, on the questionnaire, it says, if you eat fatty foods, do you have problems? And they'll put no on there. If you ask them, do you ever eat fatty foods? They say, oh, no, I never eat fatty foods. Well, why not? Because it gives me problems. So sometimes they don't always answer that correctly. So a good thing to ask a patient, I like to ask a patient, how do you do with fatty foods or greasy foods? Oh, terrible. If they say this, that's a good clinical indicator that there's some liver, gallbladder, hepatobiliary issues. They've got some bile issues going on. All right, so there's some underlying issues that can cause your 5R program really to kind of go awry, and you're going to need to, we have to deal with these issues. So bad diet leading to dysbiosis, I guess that would kind of go with the 5R program anyway. If you have a leaky gut, you're probably going to have to do a little bit more. If you have true leaky gut, like a lot of times we just call things leaky gut, they're really not leaky gut. There are other issues that are going on. But if somebody truly has a leaky gut, then you're going to have to do a little bit more extra work. And here again, that's another topic for another time. Gallbladder issues. Somebody could have gallstones, gallbladder sludge, and you're going to have to do a little bit more extensive work. And somebody has SIBO, and there's other things, early neurodegenerative diseases. In fact, Parkinson's first early site is the GI tract, and you have something called alpha synuclein. Synuclein is a protein that is made in the gut. It goes from the gut into the vagus nerve, travels through the vagus nerve into the base of the brain, and that sets up a damage to that the base of the basal ganglia, substantia nigra, the bottom part, just lower than the basal ganglia, and that causes problems. You can have intestinal autoimmunity. You can have some people that no matter what diet they use, it just doesn't work. They're frustrated, they've gone everywhere, and they've tried every single thing. Well, you may actually want to go through the process of evaluating them for antibodies for different tissues in the gut, because they actually might have an autoimmune disorder going on to the gut, and you're going to be frustrated if that's what's going on with them, and you're trying to fix them with food sensitivities, you're trying to fix them with different things. Now, that's not that those things won't help with that, but if you have an actual autoimmune process, then that's something that needs to be evaluated. Celiac disease, demyelination, and low thyroid. Yeah, watch out. Somebody can have low thyroid, and you can do whatever you want to with the bowels, and it's just not going to move because they're just too sluggish. Okay, so I'm going to stop just for a minute before I move on and ask Dr. Annette if we have any questions.
Not yet.
Do we have any questions? What's that?
I don't see any.
Okay, very good. Well, let's truck on then. Okay, so here are some things just to keep in mind that can keep that intestinal lining broke down. You know, people are on NSAIDs every day. They've taken antibiotics, gluten, stress, GMO foods, alcohol. You know, this is a big one. They say over one drink, and that's like over 5 ounces of wine, one shot, one beer. That sounds like that's that guy that's saying that one whiskey, one bourbon, one beer, something like that. One song. But anyway, so anything over that has potential for breaking down the gut. Viral, fungus, bacterial infections, parasites. These are all things that can actually be a problem. So you're trying to help this person, and if they have any of these things going on, you know, emotional trauma. You know, somebody's under a lot of stress, and you're trying to, you know, help them fix a leaky gut. It's very difficult. You know, these are things you want to pay attention to. Okay, this is an actual test. If you think somebody has a leaky gut and you want to evaluate, Cyrex has a really good test. I think it's array number 2, and it goes through and it looks at the actomyosin and gluten bonds. It also looks at LPS. If you're leaking LPS like this, then that means that you have a leaky gut, because it has to be coming from that gut and leaking through. These are very specific, the gluten, you know, zonulin bonds. If they're broken down and you see that shows up in the blood, you know, then we know we have antibodies for it. Then we know that we have some leaky gut. So if you really want to go in and know if somebody has a leaky gut, sometimes it's actually a good idea, because it gives you a reference point with a patient, and that way you can come back in 6 months and come back and check. I'll give you an example of when I use this. I'll use this test if I have somebody that has like neurodegeneration, dementia, Parkinson's, or some kind of brain-based issue, or some other issue where I know that that gut is creating so much problems for them clinically that I just need to evaluate this. It's not that expensive of a test. I think it's $195 our cost. So you can run this one easy enough. I don't run this on every patient. As a matter of fact, I don't run it that much, but I will run it in specific cases, and it's very helpful. All right, so let's talk about this. For the next 30 minutes, we're going to talk about identifying patterns as they're related to HCl, related to digestive enzymes, and related to bioflow. So let's get started. So for HCl, and keep in mind, if HCl is low, nothing good happens south of that, okay? So we use this metabolic assessment form. This is something that Dr. Karazian developed a long time ago, and you see it everywhere, but I like to use it because it goes through the functional categories, and this is category number 2. And if you look at this right here, this section right here is related to low HCl. So in other words, people can have complaints along the lines of, let's just put this in here so I can have it. Let's say somebody says they have, you know, they have belching, they have burping, or bloating, and that they're a 2 at this. 0 means they don't experience it at all. 1, 2, and 3. 2 is like 50% of the time. 3 means 100% of the time. And so they have gas immediately after meals. And let's say they have difficult bowel movements, and we have 0 and a 0. Well, if I see something like that on, you know, on their initial form, without even seeing this patient, I already know that there's a good possibility they're dealing with HCl problems. Now, it doesn't matter what their complaint is. Maybe they're coming in with psoriasis, they're coming in with Hashimoto's, they're coming in with migraine headaches, they're fatigued, or whatever they come in with. This is a very foundational thing, because remember, we have gastrointestinal signs and symptoms, but we have non-gastrointestinal signs and symptoms. And whatever the patient is suffering from, maybe it's fatigue, psoriasis, or whatever it is, if they have low HCl, then they are not, their digestive tract is not going to be working well. So this becomes one of those issues that must be dealt with. Now, this might not solve all their problems, but you can't solve their problems until you at least take care of this issue. And let me see if I can do it this way. So when somebody comes in, and let me explain it this way if I can. Whoops, where's my white at? I need white. Okay, I don't have white. So hold on, let me try a little different. So when somebody walks in the door, okay, just as a basis, somebody walks in the door, there are foundational elements that we have to take care of. And I'll give you an example. I had a patient come in today. She's a traveling patient, and she's been studying. She wants to do functional medicine. She's been doing some training at the college level. She's done a lot of Dr. Google stuff. So this lady had a lot of information, and she's really big time into methylation. So she came to me a month ago or so with some issues, and she really wanted me to check out her methylation problems. And so I did a history physical exam, did my blood workup, and today I sat down with all the blood and explained to her that, yeah, she probably does have a methylation issue, but if she doesn't solve some of her basic foundational issues, it doesn't matter what she does with methylation. It's really not going to be that effective, because if you're running around, you have low HCl, for instance, good luck on really getting your health back, because that's a basic cornerstone to basic function of the human system that we have to have. It's not the only one. We talk about blood sugar, having anemia, the liver working well, but also hydrochloric acid, the pancreas, digestive enzymes, the bile flow. All these things are important for foundational things. So no matter what a patient has when they come in, I'm always going to address these. And I'm sorry to take time in this webinar to go over that, but I just wanted to make, really to make that clear. So let's go back here. So if somebody comes in and they have, they look like this on here, I already know I'm going to have to deal with some hydrochloric acid issues. I always like to look at patterns. Patterns are really key to having success in functional medicine. If you can understand patterns, you can understand how to build strategies. You build strategies, and that's how you have success. And let me explain this. When a patient comes in, you're always going to do your history. You're going to do a physical exam, and then you're going to run labs. You're always going to run at least basic blood work and maybe your analysis. So what we're looking for is we're looking for patterns. And I'll give you a great example of what a pattern would look like. So somebody comes in, they have belching and burping right after they eat, and they have bloating right after they eat. That would be part of the history. And that's a pattern that kind of fits low hydrochloric acid. When we do the physical exam, maybe they're a little tender in that epigastric region. We do abdominal exam. We do the blood, and we see they have a functionally low protein, it's under 7.1, and they have a functional low calcium, it's under 9.2. Let's say the protein's sitting at 6.7 and their calcium is sitting at 9.0. That's a little bit low on each one of those, but it's an indicator they're not absorbing or breaking it down well. If they have, for instance, if their questionnaire looks like this, right? And then you do abdominal exam, you feel soreness there, maybe you don't, but then you come to your blood and you see that would be a pattern that fits together that shows me this person has low HCl. And so we're going to work through that. Here's a patient right here. I'm not going to go through the patterns just for time's sake, but I wanted to show you the blood. So here's 6.2 on the protein, and calcium is 8.5. Now remember that if you don't have hydrochloric acid in the stomach, you can't break down into the polypeptides properly so that you won't get the protein in. But also, if you don't have enough hydrochloric acid, you don't absorb calcium. You don't absorb B12. You don't absorb iron as well, and you don't absorb zinc as well. But on the blood, we can see the calcium readily, and we can see the protein. So we can see in this patient, they have low protein, low calcium, and that would fit a pattern of low hydrochloric acid. So this is a few months later, and the calcium is now at 9.1. Protein was at 6.2, now it's 6.7. So she still has some progress to make, but she is making progress. I'll show you something else that's really cool about this one. The creatinine, this also fits the pattern. If you look at a muscle, its waste product is creatinine. So when a muscle's working, it's going to have kind of like exhaust coming out of your tailpipe. It's going to have creatinine coming off as a waste product. When you have low protein in your muscles, if you've lost protein in your muscles, you're going to have a low creatinine. That's the reason why we check it on our ADHD kids. That's the reason why we check it on our older folks to make sure they don't have sarcopenia. Creatinine is a very important analyte to understand the patterns of these things. So if somebody has low protein, look at that creatinine and see what's going on. And if you look at that, she's 0.39, and now that creatinine's bounced back up to 0.7. So her protein is not perfect, but our utilization of protein has become a lot better. And the reason why, I think, is because the calcium went from 8.5 up to 9. So we're seeing a really good result with getting protein in the muscles, a really, really good sign. All right, so let's talk about proton pump inhibiting weaning. Before we do that, let me talk about this real quick. So if somebody comes in and let's say they have a little bit of heartburn, okay, or they have acid indigestion, they have GERD, they have problems with it, and you know that you see a pattern of low hydrochloric acid. Well, what we need to do, here's what I do. I start them off on taking apple cider vinegar. I'll have them take a teaspoon of apple cider vinegar, okay, right after they eat. Right after they eat and up to 30 minutes after they eat, take a teaspoon of apple cider vinegar. If they don't have any reaction to it, on the next meal, I'm going to have them take 1 HCl tablet and see if it causes their stomach to burn, okay? So what I'm going to do is if they don't have any burning, then I'm going to have them titrate the HCl up. So each meal, they're going to add 1 HCl until they feel a little bit of burning. And it shouldn't be a harsh burning, but they should feel like a warm glow on there. Give you an example. Somebody starts off with apple cider vinegar, and then they did okay with that one. They did the hydrochloric acid. They did 1. They did okay. So you went to 2, then you went to 3, then you went to 4, then you went to 5. Once they got to 5, they feel kind of a warm glow in there. Okay, on the next meal, don't take 5, but go down to 4. And you might stay at 4 until you will stay at 4 until they feel a warm glow, and then you go back down. Not always, but many times you can titrate them up and they'll have that warm glow, and then you begin to titrate it down, and you'll get them where their own parietal cells will actually start making more hydrochloric acid, and then you call it a day, you're good. In some cases, they just never will. If you titrate them up and you've got them on 8 or 10, HCl tablets, go ahead and back it off and just give them 3 or 4 and see how they do with it. And that really might be a lifetime thing for them in helping with the digestive process. Keep in mind, once you hit 55, this is the discouraging news, if you will. Once you hit 55, there's a thing that happens that you start making less hydrochloric acid. All right, so low HCl can happen just from simply aging. Okay, another thing that can happen is if you have cortisol. If you have too many cortisol surges, like from blood sugar dysregulation, you have cortisol surges. Number 3, if you have low thyroid hormone, because you need thyroid hormone to actually help you make HCl. You also need cortisol. So if your cortisol is not predictable, it's surging because stress responses from things like blood sugar dysregulation dropping, or if you have low functioning thyroid, these are all things that can cause you to make less HCl. Okay, so that's the way that I would go about giving somebody HCl. Now, if they don't have any heartburn, no GERD, no signs, symptoms of that, I would skip the apple cider vinegar and go straight to the HCl tablet. If they do if they do have heartburn, you give them apple cider vinegar and they taste it and it's too much for them, then water the apple cider vinegar down. Maybe put it in 2 ounces of water and have them drink that. If that's too much, put it in 8 ounces of water, and then you're going to build them up. Okay. So let's talk about a case, because I want to talk about how to wean off of protein pump inhibitors. So when somebody, I'll do the protein pump inhibitors weaning, and then I'll show you a couple of cases. All right, so for proton pump inhibitors, and by the way, these are terrible drugs, absolutely terrible drugs, and I make it my mission when somebody comes in to get them to a place where they don't need it anymore, because it's one of those kind of, as I said, underappreciated, but it just seems like it's kind of innocuous. It's kind of easy. It's kind of, you know, everybody's on them, you know, what's the big deal? But it is a big deal, because when you're taking a proton pump inhibitor, as I said, nothing good happens south of there. Your digestive enzymes are going to be deficient or waning. Bile flow not as good. You're not going to build the microbiome. And this sets you up for more food sensitivity, more inflammation in the GI tract, more inflammation in the brain, more inflammation in the body. And this is just a bad, bad cycle. So let's talk about what I would do to help wean somebody off of the proton pump inhibitors. So if somebody's on a proton pump inhibitor, first thing we have to do is we start the process of the 5 R's. Okay, so we're going to go through and we're going to look for food sensitivities. We have to find out what foods they're sensitive to. Okay, number 2, I am going to go through a process. I like to use something called Gastrozyme, and that's from Biotics. I love Gastrozyme from Biotics. It has, I think, marshmallow root and other things in it. And I'll have them taking 3 to 4 of those after every meal. I will have them drink aloe juice. You can have them drink 1/4 to 1/2 cup of aloe juice after every meal. This helps soothe the stomach lining and helps soothe that area in there. So those are things that you can do to help with that. So you're going to start with food sensitivities, have them off the junky foods. You're going to start them on Gastrozyme, and you're going to start them on aloe juice. There's also a product from Biotics I'll talk about in just a little bit, but let's talk about just doing this right here. And then ideally, if they're on a proton pump inhibitor, then I would have them, best thing to do it is only take it every other day and see how they fare. So I'm going to go for 2 weeks where they're skipping it every other day. So they take it one day, and then the next day they don't take it. Next day they take it, next day they don't take it, and just see how they do. After about the 3rd time of doing it, they may experience some burning, and you just try to coach them through it. If the burning's too severe, then you're going to have to back up your process and maybe only have them not take it every 3rd day, and then maybe every 4th day, or whatever the case may be. But you start every other day. If they do good for 2 weeks at every other day, then I'm going to have them only take it every 3rd day. So they're going to skip 2 days, take it a day, skip 2 days, take it a day. We're going to do that for 2 weeks. And if they're doing okay at that point, then I'm just going to drop them off and see how they do. Most people will be just fine doing that. Some of them, you just have to take it slower. Everybody's an individual, so you just have to work through the process. But explain to somebody also that if you can tell them this as you being the physician, as a doctor, I don't have any, digestive issues. And if I were to take a protein pump inhibitor for 6 months and then I immediately stopped it, I would have heartburn. So just let the patient know that this isn't just going to necessarily be easy street, but you're going to have to, we'll have to work through this. Some people have minimal problems as they go through this, but some people have more. So you might be one of those people that faces more problems. We'll communicate with you as we're going through this, and we'll try to find out that best level for you. But at the end of the day, keep the goal in mind. We have to get you where you're absorbing calcium, zinc, B12, iron, breaking down proteins, reducing, the inflammatory process in your gut, helping your bile flow, helping your digestive enzyme flow. This is for your overall health. We really need to get with us. And if you can help people keep that goal in mind, I think that's helpful. So those are some of the things I do to help with the weaning process. I don't have all the answers. Nobody does. You may have some pet thing you like to do that helps. And God bless you, that's great. Exchange some ideas. Let's talk about it. we can always improve what we're doing. But these are things that I've done that's been pretty successful. Here's a 54-year-old female, 20 plus years on a proton pump inhibitor. So she comes in, and her big issue is that she is overweight no matter what she does. She's tired, stressed, she's bloated, and her stomach hurts. So you can see right here, bloating. She has Barrett's esophagus, so she has some issues there. She wants to know what she should eat, what she shouldn't eat. So those are things. Okay, so let's look at this right here. When she eats right here, let me get my white out because I think that it might actually show up better. Okay, you see this right up here? This is the one that shows low hydrochloric acid, and you can see this. She's all over the place, but she has bloating immediately when she eats food, and she gets gas immediately upon eating foods. She has low hydrochloric acid, but guess what? She's on a proton pump inhibitor for 20 years. Of course, she's going to be low in hydrochloric acid. She also, we haven't had a chance to get into it, but this is more to do with the pancreas, small intestine, digestive enzymes, so she's having problems with that as well. All right, so let's look at some of her blood. If we look at her blood sugar, this is interesting because she's overweight, but guess what? She has low blood sugar. We need to have 85 is perfect. When you go 80 or below, it means that the liver has not been able to store sugar through the night. You lose about 60% of your sugar storage in your liver when you sleep at night. But if you have low blood sugar, you're losing more than that, and you're not able to maintain your blood sugar high enough. And so when you do a fasting blood sugar test like this, it comes up lower than 80. So she has hypoglycemia. Not only that, she has low sugar, but look at this. She also has low fat. So she has low fat, low sugar, and look at this. She has low protein. So when you eat food, what are the three basic macronutrients you get out of food? You get protein, you get fat, and you get sugar. Guess what? She's low on all of these. So if she were to tell me, I'm tired, I'm depressed, I'm fatigued, I'm gaining weight, you can gain weight with malnutrition. I have an autoimmune disease, you name it. You could tell me anything this patient has, and I would not be surprised because it's a very foundational element. This person, God bless her, she's eating food. She's not getting nutrients out of her food, right? So she's low in fat. She's not absorbing fat. She's low in sugar. She's not maintaining that well. And she's low in protein. She's also low in calcium. If you remember, I talked about there's a pattern that goes along with blood chemistry that looks like low calcium, low protein means low HCl, okay? So what we did with this patient is we went through the process that looked like this. We put her on we started off initially on a 12-week program, and we had her follow food sensitivities. If you've done if you followed any of my work, you know we do a lot of blood sugar boot camp, so we did that. We did that as well. We added some HCl, but we first started with apple cider vinegar and worked our way up to the HCl. It took us a while to do that because we had to work her off of the proton pump inhibitor and then work her back onto that, okay? So this was the result. Where's my result? Okay, so this was the result. So the fat was at 70. It came up to 79. We need triglycerides to be 75 to 110, so that's improving. Glucose was at 79. Now it's at 83, so that's improving. The protein still has some work to go. 6.2, 6.4. She's making progress, so we're actually doing pretty good with this. We're really okay. We just need to keep on, but keep in mind, we were a little bit inhibited through the first 12 weeks on this patient because we couldn't even give her HCl. We had to wean her off first of the PPI, and I did it exactly like I just showed you just a moment ago. Now, I'm going to ask for questions here. I've got one more case I want to go through, but I want to invite you guys because on February 13 and 14, I am doing a DAPC seminar, and it's going to be 12 hours of me going through the GI tract. And I'm going to go from north to south. We're going to talk about so many issues we just can't do in an hour here. We're going to break it down for you so you can put things clinically right into work. I'm going to invite you to join along with that. If you want to do that, you can actually call Pro Health Seminars and just call 573-341-8292. That's actually our office number, but they can give you information about it. You can also go to Pro Health Seminars.com. Pro Health Seminars, that's an S at the end. ProHealthSeminars.com, and I believe they can register there. So Dr. Annette, do we have questions, and do you have any other information on how they can register for the upcoming GI DAFC seminar?
Hi, yeah, you can go to the Pro Health Seminars website and then click on the Seminars tab and download a form to fill out, and then you can just fax it over. And we do have a couple of questions. You can also call the office if you want to do that. And if you're somebody that's attended in the past, we probably have your information, so it's really simple. Somebody wants to know, let's see, it says, I've tried to wean a patient from PPI. Her main struggle is her cough. Any advice on supporting or resolving this? She's been on them for a long time.
Okay, so the cough, yeah, I'm suspecting because the question was asked that she's having like a silent GERD, or actually it's not maybe not a silent GERD, but she's having reflux and it's going down into the lungs. Do you think that that's what that they're talking about there? If that is the case, then also make sure that she's not on an ACE inhibitor. ACE inhibitors for blood pressure can cause chronic coughing, so it might not be from the GERD, it might be from that. Also check to make sure she doesn't have a chronic virus or something like that that could be causing the cough. If not, if it's coming from the GERD, then you have to just keep on working on what you're doing working on the digestive tract, working on leaky gut, and some of the things that actually we weren't able to cover in this seminar. But yeah, you just need to do more GI work, and sometimes it just takes more time really to get to that. Any more questions?
When are they supposed to add the hydrochloric acid pills? During the meal, before the meal, or after the meal?
Oh, thank you. Okay, you want to do it after? Up to about 30 minutes, it's going to be effective. But really, even if it's like an hour later and they forgot, go ahead and have them take it, because keep in mind, when you take the hydrochloric acid, it will just help that process move, and it's better in that right afterwards up to the 30-minute window. Okay? Any other questions?
And then what is your suggestion to raise triglycerides?
Okay, so that would there's a couple of things. Number one, you have to figure out why the triglycerides are low. Sometimes there's some liver issues, liver congestion, so you have to work through that. Sometimes there's bile flow issues, so you have to work through that. And that's some of the things we'll talk about, of course, in the seminar, the GI seminar, where we can do it in depth. I may actually do a webinar sometime really just on bile flow, and I might just do a seminar just on food sensitivities, and maybe a seminar just on digestive enzymes, because it takes, you think you can cover a lot in an hour, but it just comes out that way. So any other questions?
Let me see. There is another one. Are there any contraindications to hydrochloric acid if someone has Barrett's?
Yeah, well, actually, you're going to be able to see it if they have Barrett's. It's going to burn if they're having any issues with it. So most generally, you're going to have, you're going to have some burning in there if they have, sores and that kind of thing, if they're having the reflux. But if you have any doubt about it, like if you're really concerned about it, you can always stick with the apple cider vinegar. It's just not as strong as the HCl. But this lady that we have on that had Barrett's, we have her on HCl. We're keeping her monitored, and we will have her monitored for the Barrett's as well. We're not just going to leave that go. We'll watch it, make sure that it is improving and it's not getting worse, and it probably will be improving. Any other questions?
Nope.
Well, that's good. Well, I want to really quickly, if you guys would like to, this is the rest of the case. She came in for her losing weight. Of course, she started at 195, and you could see over the course of time, she's at 153. She didn't lose weight really quickly. She just did it fairly slowly. But I have to tell you, one of the most important things we did for her was getting her off that PPI, because they're just that important. Because if you're not getting the basic nutrients out of your food, you're just not going to do quite as well. Here's an H. pylori infection case. This case came in. She said everything she eats causes bloating. That sounds like HCl problem, right? She has low energy level, that's infection. Got very sick the day after eating at a Chinese restaurant at the beginning of 2019. So this could have been the impetus for whatever reason. She tested positive for H. pylori back in 1999. But guess what they did in traditional medicine? They did what they always do. They don't do anything with H. pylori. They just give you a proton pump inhibitor because that reduces the acid, reduces the pain, and then they call it a day. Relatively compliant with food sensitivities. So here's some of her blood tests right here. We can see that her alkaline phosphatase is high, and that would fit a pattern of sluggish bile. Sluggish bile. We have, where's the bilirubin? That's fine right there. 7.1 neutrophils, don't see a lot there, don't see a lot there. We actually did the H. pylori test for her, and it came out positive. And here's what we did. We did basically what we just talked about. We had her take Gastrozyme, 3 of them, 3 times a day after every meal. We had her take the aloe juice. And additionally, I had her do ACS silver and total back tea. This comes from NutraWest. NutraWest has a product called Total Back Tea. It's a tincture. You have them put a dropper full in water, have them take 30 minutes before breakfast, and 30 minutes before bed. And you want to do that for 4 to 6 weeks. It's cat's claw. And I've had great success with that, using that along. You can either use liposomal vitamin C. We used IV for her, but you could use liposomal C. And then as soon as we went through this protocol, then we followed the PPI protocol, just like I talked about. So we did the same thing, and she worked through that. If you have H. pylori in the past, there's at least a reasonable chance you may get it in the future. So what has to happen with these cases is contrary or counterintuitive as it may sound, we must get them where they have full amount of HCl in their stomach, because at the end of the day, that's what kills off the H. pylori, so it's not able to grow. So we really have to have a good complement of the HCl in the stomach in order to fight off that H. pylori. Here is a substance. Here's also a nutrient you can use for H. pylori that's from Biotics. I did not use that in this case, but you can. I have used it in the past. Okay, very good. Well, thank you guys so much for being a part, participating in this webinar. It looks like we had a ton of people out here, so that's always good to see. Thank you for listening. Are there any more questions before we close this, Dr. Annette?
I don't see any.
Okay, well, God bless you guys, and we'll do this again in a month. I invite you to join along with us for the DAPC seminar, February 13th and 14th. You're going to learn a ton of practical clinical information that you can use on your patient that next Monday morning, and I think it'll take you to the next level. Thank you guys so much, and God bless.